Corewell Health is the largest hospital system in Michigan. We're made up of 21 different hospitals covering a lot of specialities across the United States. My particular interests are in neurosciences. I concentrate a lot on Alzheimer's disease, looking at etiology, pathophysiology, and biomarkers for the early identification of those people at greatest risk of developing it. Also very interested in Parkinson's disease, epilepsy. We want to look at stroke. We want to look at those individuals who have had a traumatic brain injury, trying to understand the pathophysiology of these conditions, and also if we can identify biomarkers, either prognostic or diagnostic. Then again, we've got a lot of other researchers who excel. So if we're able to identify those patients correctly, get them into the right trials, you're going to save a lot more money and you're going to get the proper treatment to the right person at the right time. And having VUGENE, well, first off, they make my life easier.
One of the things that we are doing together with Stewart is building ways to predict the disease earlier.
They allow my scientists to stick to the science, and they can trust somebody on the back end to get them the analysis they need for their publications and for their grants.
Behind the scenes, we're building it into a more productized solution. It's a product that can scale. And we achieve this by automating a lot of things. We are streamlining, automating, and making things much faster.
They allow us to make discoveries faster, which is extremely important. There's the speed, but there's the accuracy and there's the high throughputness of it. Whereas previously it would have took us 6 months to a year, whereby I get a turnaround in a month. So it makes it a lot easier for us. So they know what our workflows look like, but they've taken them and they've made them better.
With Stewart, we have been able to look into different layers of omics, not only metabolomics, but we have been looking also into epigenetics and transcriptomics, and we have put together all these different layers.
They've got a good rounded expertise. They've got a good mixture of masters and PhD trained individuals, folks with expertise in genetics, epigenetics, transcriptomics. Teamwork is a central theme to VUGENE, which is important.
We started seeing a picture how you can have a transcriptomic layer translating things into metabolomics when the person is healthy, and when you have a disease, this relationship disappears. This gave us an entirely new mechanistic insight into how the cell works.
It's that personalization, that personalized touch that you get as well by working with VUGENE.
At the end of the day, you have to get the data and figure out from a lot of the noise what is actually important in that noise and what is predictive of a disorder. Probably the core value is that we care. We care about the research that our customers are doing.
They're doing things which are unique, they're doing things which are novel, they're bringing new tools all the time to this niche area of research, and they're just allowing us to get out in front of the public faster.